Welcome back, dear viewers, to the YouTube channel Doctor's Wisdom Share. We very often confuse muscle shivering, muscle trembling that occurs in order to increase body temperature, with febrile seizures. This is an extremely common misunderstanding, and in reality, it has very important implications for health, especially in young children. I once encountered a very interesting case. The child of one of my colleagues was in 8th grade. The child was very fond of biology and had a dream of becoming a doctor in the future. The child independently searched for information on educational websites and read multiple choice questions that already had provided answers. But what made the child feel puzzled was this: there were answers, but there were no explanations of the underlying mechanisms. The question that the child read was the following: there were two patients who both had a fever. Why did the doctor instruct one patient to apply a cool compress, while instructing the other patient to apply a warm compress in order to reduce the temperature? The answer that was given was very brief. A hot fever should be treated with a cool compress. A cold fever should be treated with a warm compress. But the problem lies in the fact that there was absolutely no explanation of the mechanism behind that answer. When this question was passed on to me, I realized that it was not only students who felt confused, but even many adults and even people working in the medical field also felt awkward and uncertain when they had to explain this thoroughly. In fact, when we talk about fever, most of us think about it in a very simple way. If there is a fever, we take fever-reducing medicine. When the fever goes down, we assume the illness is resolved. So then, why would we need to devote an entire long program just to talk about fever? The answer is precisely because we consider fever too simple. We very often handle it incorrectly. In the past, when I was first studying medicine, knowledge about fever had not yet been widely updated as it is today. At that time, doctors commonly passed on the idea to one another that, if there is a fever, apply cold compresses because fever is hot, and heat should be treated with cold. Later on, when people realized that this approach had problems, they swung to the opposite extreme. Whenever there was a fever, they applied warm compresses. In reality, both of these extreme approaches are incorrect because we have not fully understood the mechanism of fever. In order to correctly understand when to apply warm compresses or cold compresses, we must first understand that fever has 3 stages. Let us imagine it like this. Each person's body has a baseline temperature, temporarily called a set point, for example, around 37 degrees Celsius. When fever occurs, body temperature does not increase randomly. Instead, it progresses through 3 very clearly defined stages. The first stage is the stage of rising temperature. From the initial baseline level, the temperature is pushed upward. The second stage is the stage where the temperature is maintained at a high level, meaning the temperature remains relatively flat at a certain level. The third stage is the stage where the temperature goes down, meaning the body temperature begins to return toward normal. Why does the body do this? Because fever is actually a weapon. When viruses or bacteria invade the body, the immune system has to fight. And in order to fight, the body needs a weapon. That weapon is temperature. Right in the brain, specifically in the hypothalamus, the body sets a new temperature level, high enough to combat the disease-causing agent. For example, with a certain virus, the body may set the temperature at 39 degrees, 40 degrees, or even higher. When this new temperature level has been set, the body enters the stage of rising temperature. From 37 degrees, the body temperature is gradually pushed upward until it reaches the newly set level. When that level is reached, the body and the disease-causing agent enter a tug of war. Whichever side wins, the temperature will eventually go down, but it will go down through very different mechanisms. Only when we understand these 3 stages can we understand when to apply compresses, what type of compress to apply, and when compresses should not be applied at all. Now let us return to the first stage of fever, the stage of rising temperature. In this stage, the body does 2 things at the same time. The first thing, it reduces heat loss to the outside. The second thing, it increases heat production inside the body. To understand this, we need to visualize how the body normally dissipates heat. Under normal conditions, heat is mainly dissipated through the skin, via sweating. In order for sweat to evaporate, blood must be directed toward the skin, and the peripheral blood vessels must dilate. But when the body needs to increase temperature, the very first thing it does is constrict the peripheral blood vessels. Blood is no longer directed toward the skin, and heat is no longer released to the outside. Therefore, during the stage of rising temperature, we observe very characteristic signs. The skin becomes pale. It looks white and bloodless. When touching the skin, it feels cold, especially the hands and feet. Goosebumps appear. The skin feels shivery and overly sensitive to the touch. These are signs indicating that the peripheral blood vessels are constricting in order to retain heat inside the body. At this moment, even though the internal body temperature is rising significantly, the patient feels extremely cold. Some people shiver violently. Some people just want to wrap themselves in blankets and wear many layers of clothing. This is a completely normal bodily reflex to conserve heat and increase heat production. At the same time as reducing heat loss, the body begins to increase heat production by increasing metabolism. The first thing to increase is carbohydrate metabolism. Sugar is burned to generate energy, and that energy produces heat. If sugar is insufficient, the body mobilizes protein, which means muscle. If protein is also insufficient, the body continues by mobilizing fat. That is why, during the stage of rising temperature, patients often feel utterly exhausted, do not want to do anything, and only want to lie still. In particular, when the body mobilizes muscle to generate heat, the muscles begin to tremble. And this is a very important point. Many people, especially parents, mistake this muscle shivering for seizures. Muscle shivering occurs because metabolism increases and the muscles tremble in order to generate heat. Seizures, however, are caused by injury or dysfunction in the brain. These two phenomena are completely different, but because parents see their child's arms and legs shaking, many panic, assume it is a seizure, and then handle the situation incorrectly. So, during this temperature rising stage, what happens if we apply cold compresses? We all know a very simple principle. Cold causes things to contract. Heat causes things to dilate. When the body is in the process of fever with rising temperature, the peripheral blood vessels are already constricted. If at this moment we apply cold from the outside, the blood vessels will constrict even more strongly. Stronger vasoconstriction means that heat escapes even less. Heat being trapped inside means the internal temperature rises even faster. In other words, applying cold compresses during the temperature rising stage not only fails to reduce the fever, but actually makes the fever rise faster. That is precisely why the belief that fever is hot, so it must be treated with cold, is incorrect at this stage. And this is also exactly why, in the biology competition question for 8th grade students that I mentioned earlier, the correct answer was, at this stage, one must apply warm compresses, not cold ones. If warm compresses are applied, the peripheral blood vessels will dilate. When the vessels dilate, sweating increases. When sweating increases, heat is released to the outside. Muscle shivering decreases. When muscle shivering decreases, metabolism decreases. When metabolism decreases, less heat is produced. However, at this point, a more important question arises. Should we apply compresses at all during this stage? Because we must remember one very fundamental principle. Fever is the body's weapon against viruses and bacteria. The hypothalamus has already set a new temperature level for the purpose of fighting. If at this moment we continuously intervene to dissipate heat, we are, without realizing it, working against the body's self-protective mechanism. The body is very intelligent. It rarely does unnecessary work. If it creates a fever, it means it needs that weapon. Therefore, in most cases, during the temperature rising stage, compresses are not necessary. And applying compresses at this time usually does not bring any clear benefit. However, there are special situations. If the set temperature is too high, exceeding the body's tolerance, for example, reaching 41 degrees or 41.5 degrees, then the body can fall into a series of dangerous disturbances. This is particularly dangerous in young children, especially those under 6 years old, and even more so under 4 years old. Children's brains contain a high proportion of water, and their nervous systems are not yet fully developed. As a result, they are much more prone to febrile seizures. In such cases, we are forced to intervene to lower the temperature, even though we know we are interfering with the fever mechanism. But we must clearly understand one thing: the effectiveness of compresses or fever-reducing medications during this stage is very limited. Many families have a familiar experience. They give fever-reducing medicine and wait for a long time, but the fever does not go down. If it does go down, it only stays down for about 30 minutes. After that, the fever rises again, sometimes even higher than before. The family panics, rushes the child to the hospital, and demands that the doctor do something to bring the fever down immediately. In reality, this happens because the body is still trying to reach the temperature that has already been set. No matter how much we try to fight it, the body continues to push the temperature upward. Fever-reducing medication at this stage usually only lowers the temperature by about 0.5 degrees Celsius. After that, the fever returns very quickly. Warm compresses are similar. Warm compresses may help a little, but very soon afterward, the body transitions into the next stage. The next stage is the second stage of fever, the plateau stage. When the body enters the second stage of fever, which is the plateau stage, the situation is now different. At this point, the temperature has risen to the level that the hypothalamus set in order to fight viruses or bacteria. It does not continue to rise further, but instead remains at that level. During this stage, we will observe signs that are very different from those seen in the temperature rising stage. The skin is no longer pale and cold. The skin begins to regain a healthy flush. The hands and feet are no longer cold. They no longer tremble or shake. Goosebumps disappear. The patient, even though the temperature is still high, feels much more comfortable compared to before. If the patient is a child, we may see that the child begins to play again, even though the fever is still high. If the patient is an adult, the fever is still present, but the person feels less chilled, less exhausted, and no longer shivers. These are signs indicating that the body has reached the temperature it wants for fighting, and that the body and the pathogen are now locked in a struggle with each other. During this stage, the body no longer needs to significantly increase heat production. It also no longer needs to retain heat by strong vasoconstriction, as it did in the previous stage. So the question arises, during this stage, should we apply compresses or not? From a mechanistic standpoint, if we apply warm compresses, the peripheral blood vessels will dilate a bit more. When the vessels dilate, heat can be dissipated outward. This can cause the temperature to decrease somewhat. However, I want to emphasize one very important point. If the patient does not show signs of disturbance, it is simply a fever, with slightly reduced appetite, a bit of fatigue, but the patient is still alert, not short of breath, not having seizures, not cyanotic, then there is no urgent need to apply compresses or to take fever-reducing medication. Because at this stage, the body is still fighting. Excessive intervention can sometimes prolong the illness. However, if during this plateau stage the patient feels extremely uncomfortable, very exhausted, has severe headaches, or shows signs of possible disturbance, especially in young children, then it is reasonable to consider fever-reducing medication or gentle warm compresses. But we must understand clearly, we do this not to eliminate the disease, but to help the body tolerate the battle better. After this plateau stage, one of two situations will occur. The first situation, the body wins. The second situation, the disease-causing agent gains the upper hand. If the body wins, we move into the third stage, the stage where the temperature goes down. This stage is very easy to recognize. The body begins to sweat heavily. Sweat pours out as if the person were bathing. The patient feels more comfortable, lighter, and more relaxed. The temperature drops very quickly, sometimes within just a few hours. This is the point at which the body has won the battle. It no longer needs to retain heat. It begins to strongly dissipate heat outward. During this stage, many people, both children and adults, have a very natural desire. They want to bathe. And I want to say this very clearly. During this stage, it is completely acceptable to bathe. It is not true that having a fever always means you must not bathe. The key issue is how you bathe. You should bathe with warm water. You should bathe quickly. You should not bathe for a long time. You should not use cold water. You should not soak for a long time in a drafty or poorly ventilated room. If bathing is done correctly, it is not dangerous at all. On the contrary, it can help the patient feel much more comfortable. So what about compresses during this stage? From a physical principle, effective heat dissipation requires a temperature difference. At this point, the body is hot and sweating heavily. Therefore, if compresses are used, cool compresses can have an effect. But in practice, I believe that during this stage, compresses are usually unnecessary because the temperature is already dropping very rapidly. Additional intervention does not provide any clear benefit. So if we summarize according to the correct mechanism, in the first stage, the temperature rising stage, if compresses are used, they should be warm, but in most cases, compresses are not recommended. In the second stage, the plateau stage, warm compresses or medication may be used if truly necessary. In the third stage, the temperature falling stage, compresses are not necessary. If compresses are used, they should be cool, but usually they are not needed. However, there is one very important situation that I must discuss separately. That situation is when the body loses the battle. In other words, the immune system no longer has enough capacity to fight. It can no longer effectively mobilize immune cells. It can no longer generate an effective fever response. At that point, the temperature may no longer rise, or the patient may have had a high fever that then drops abnormally on its own, accompanied by very concerning signs. The patient becomes extremely exhausted. The patient is drowsy and difficult to awaken. The patient has difficulty breathing. The skin may turn bluish or purplish. There may be disturbances of consciousness, especially in children under 6 years old. These signs are extremely dangerous. In this situation, medical intervention is absolutely required. This is no longer a physiological fever that can be monitored at home. But if we return to real life, fever is an extremely common phenomenon. If every case of fever required a hospital visit, the healthcare system would be overwhelmed and society would fall into chaos. That is why people need to understand the 3 stages of fever, so they know when it is safe to monitor at home, and when it is necessary to go to the hospital. That is also why fever-reducing medications, such as paracetamol, are sold without a prescription. As long as they are used at the correct dose and according to instructions, they are safe. What truly matters is not simply whether there is a fever, but which stage the fever is in, and whether the body is winning or losing the battle. Now, I want to go a little deeper into why fever scares us so much. In reality, what frightens people about fever is not just the temperature number, but what fever consumes within the body. When we have a fever, the body pays a very high price. The first cost is water. The second cost is electrolytes. The third cost is energy. When these 3 factors combine, if they are not replenished properly, fever, which is originally a beneficial response, can become a burden and a danger. First, let us talk about water loss. When fever occurs, body temperature increases, metabolism increases, breathing rate increases, and sweating increases. All of these processes cause rapid water loss. Many people think that drinking 1 or 2 liters of water is enough. But for someone who is having a fever, 2 liters of water is not enough. When the body becomes dehydrated, cells lack water, the person feels exhausted. The heart beats faster, blood pressure may drop, and when the brain lacks water, the person may feel confused, drowsy, have headaches, be sensitive to light, and be sensitive to sound. Especially in young children, whose brains contain a high proportion of water, even mild dehydration can cause neurological disturbances and may even lead to seizures. Therefore, the first principle when dealing with fever is not medication, but fluid replacement. However, fluid replacement alone is still not sufficient. The second issue is electrolytes. When fever occurs, the body loses large amounts of sodium, potassium, magnesium, and calcium. These electrolytes are critically important for the heart, the brain, the muscles, and the nervous system. Electrolyte loss can lead to a series of disturbances. The heart may beat faster or develop arrhythmias. Muscle cramps may occur. Fatigue and trembling may appear. Consciousness may be altered. Therefore, if one only drinks plain water without replacing electrolytes, the body will still feel extremely unwell. That is why I always emphasize a very practical point. Oral rehydration solution, such as aerosol, is one of the simplest yet most effective measures during fever. When prepared correctly and taken regularly in small sips, it replenishes both water and electrolytes. In many cases of viral fever, just using oral rehydration solution can already make the body feel much better, help the fever resolve faster, and in some cases, make fever-reducing medication unnecessary. I say this honestly. During the recent epidemic, many people whom I advised only needed to drink oral rehydration solution regularly and rest, and they recovered without needing any additional medication. The third issue is energy. When fever occurs, for every 1 degree Celsius increase in body temperature, the body's basal metabolic rate increases by approximately 13%. That means the body requires a great deal of energy to maintain that fever. But paradoxically, when people have a fever, most of them do not want to eat. Their mouth tastes bitter. Seeing food makes them feel averse. Eating easily causes nausea. This is not weakness. This is a self-protective reflex. When the body is ill, the digestive organs, the liver, and the pancreas all reduce their function. The body wants to rest. It does not want to spend extra energy on digestion. But if a person does not eat, where does the body get energy from? First, it takes energy from muscle. After that, it takes energy from fat. When the body burns muscle and fat for energy, it produces ketone bodies. This condition is called ketosis. In more severe cases, it can progress to ketoacidosis. The signs are very easy to recognize: severe fatigue, nausea, abdominal bloating, breath with a very unpleasant odor, a smell that is clearly different from normal. If a person reaches this state, a doctor may need to intervene with nutritional support or even intravenous fluids, but that is a medical matter, not something to be handled at home. What I want to emphasize here is this: we should not force eating during fever, but we also must not allow the body to completely run out of energy. Eat small amounts. Choose foods that are easy to digest. Divide meals into small portions. Prioritize fluids and electrolytes first. Another issue that is very often overlooked is blood sugar. Many studies show that when fever is high, especially above 39 degrees Celsius, blood sugar levels tend to rise. Why does this happen? Because the body mobilizes glycogen from the liver and converts it into glucose to provide rapid energy for the fever. There are people who are not obese, do not consume much sugar, yet still develop diabetes. When questioned carefully, they often have a history of frequent fevers since childhood. I am not saying that fever is a direct cause of diabetes, but it is clear that repeated fevers over time can contribute to long-term disturbances in glucose metabolism. Therefore, fever is not simply getting hot and then going away. It is a process that consumes a tremendous amount of the body's resources. If those resources are not replenished properly, fever, instead of being a beneficial response, can leave lasting consequences. That is why understanding fever is not just about bringing the fever down, but about helping the body get through the fever in the safest possible way. Now, I want to address a very great fear that almost every family has experienced, especially families with young children. That fear is the question: does high fever burn the brain? In everyday language, people often say high fever burns the brain, and they associate it with febrile seizures, which sounds extremely frightening. But to understand this correctly, we must separate the issues clearly. First, as I mentioned earlier, we very often confuse muscle shivering with seizures. Muscle shivering is a physiological phenomenon that occurs during the temperature rising stage. The muscles tremble in order to generate heat. This is not brain damage. Seizures are different. Seizures are a disorder of electrical activity in the brain. They are usually related to dehydration of the brain, electrolyte imbalance, or neurological injury. Because these two phenomena are often confused, many families panic excessively and manage the situation incorrectly. Second, let us talk about true febrile seizures, especially in young children. When children have a high fever, they lose water very quickly. If fluids are not replenished in time, the brain, which is extremely sensitive to water balance, is affected first. When the brain lacks water, children may become lethargic, fatigued, sensitive to light, sensitive to sound. In some cases, febrile seizures may occur. So do these seizures burn the brain or cause long-term intellectual damage? Up to the present time, serious and reputable medical studies have not found clear evidence that simple febrile seizures cause long-term brain damage or lead to epilepsy later in life. This does not mean that we are allowed to be careless, but it also does not mean that we should panic. What matters most is this: early recognition, adequate replacement of fluids and electrolytes, not allowing fever to remain excessively high for too long, close monitoring of the child, especially at night. One very important point that many people overlook is the most dangerous time during a fever. It is not during the daytime. It is at night, especially from midnight to early morning. The reason lies in the biological clock of the immune system. During the day, the immune system is highly active and consumes a great deal of energy. Toward the late afternoon and evening, immune activity gradually declines. About 1 hour before sleep, the immune system reaches its lowest level of activity. After sleep begins, the immune system gradually increases again and reaches its peak around 6 o'clock in the morning. Because of this fluctuation, we often observe the following. Fever tends to rise at night. Febrile seizures often occur from midnight to early morning. Many severe cases and even deaths occur during this time period. Therefore, when there is someone with a fever at home, nighttime is the period that requires the closest monitoring, not daytime. Parents should take turns watching over their child. Adults with worsening fever should also avoid sleeping alone. Now, I want to return to a very important question. If fever is a beneficial response, then what exactly are the real benefits of fever? Fever is not an enemy. Fever is a weapon. When body temperature rises, it allows the body to do many things at the same time. First, it helps prevent viruses and bacteria from entering cells. Higher temperatures alter the structure of cell membranes, making it more difficult for pathogens to invade. Second, fever inhibits the replication of viruses and bacteria. Many viruses can only replicate efficiently at temperatures around 37 degrees Celsius. An increase of just 1 degree can reduce their replication ability by hundreds of times. Third, fever helps mobilize the entire immune system. The immune system does not consist of just one type of cell, but rather an entire army. There are neutrophils, the frontline troops. There are macrophages, the special forces. There are natural killer cells, which destroy infected cells. There are dendritic cells, which precisely identify antigens. There are B lymphocytes and T lymphocytes, which clear the battlefield and remember the enemy. These cells release a wide range of chemical messengers, called cytokines, to coordinate the fight. Thanks to this coordination, the body not only combats the current infection, but also remembers it, so that it can respond faster in the future. Therefore, fever, when supported in the right way, is not a disaster, but a very intelligent self-healing process of the body. However, if fluids, electrolytes, and energy are not replenished adequately, if the patient is not monitored closely, if the fever exceeds the body's tolerance, then fever can become dangerous. Now, let us talk about measuring temperature. It seems very simple, but in reality, this is an area where many people make mistakes. Many people ask, should we measure temperature on the forehead, in the armpit, in the mouth, in the ear, or even in the rectum? Which location gives the most accurate result? First, we must understand one thing. Each person's body temperature is different. Some people normally have a temperature of only 35 to 36 degrees. Some people are always around 37 to 37.5 degrees and are completely healthy. Some people measure 37.8 to 38 degrees but do not have pathological fever. Body temperature depends on many factors. The first factor is the environment. When the weather is hot, body temperature tends to be higher. When the weather is cold, body temperature tends to be lower. The second factor is metabolism. People with a high basal metabolic rate tend to have higher body temperature. People with a low metabolic rate tend to have lower body temperature. The third factor is hormones, especially the thyroid gland. An overactive thyroid makes a person feel warm all the time. An underactive thyroid makes a person feel cold easily. The fourth factor is physical activity. More physical activity means more muscle heat production, so temperatures measured in muscles can be higher. And there is one more factor that is often overlooked. Body temperature differs between daytime and nighttime. At night, metabolism decreases, the environment is cooler, and there is little physical activity, so body temperature is lower than during the day. The difference can range from 0.1 degrees to more than 1 degree Celsius. Because of this, if people do not understand this variation, they may easily misunderstand the situation, thinking that there is a fever during the day, but not at night, or the opposite. So, which measurement site is closest to core body temperature? From a medical research perspective, the most accurate temperature is pulmonary artery temperature. However, this is only used in research or intensive care settings, not in everyday life. In clinical practice and in the home, oral temperature measurement is the most accurate. But oral measurement must be done correctly. The thermometer must be placed under the tongue, not on top of the tongue. The mouth must be kept closed. The person should not have just consumed hot or cold drinks. Oral temperature reflects core temperature quite closely. The second most accurate method is measurement at the tympanic membrane. However, to measure true tympanic membrane temperature, specialized equipment is required, and it is usually performed by anesthesiologists. Infrared ear or forehead thermometers, such as those commonly used during epidemics, are for reference only and cannot be considered absolutely accurate. The ear canal may be narrow. There may be earwax. The angle may not be aligned with the tympanic membrane. Forehead measurements are influenced by sweat, airflow, and air conditioning. As a result, the measured values are easily inaccurate. What about measuring temperature in the armpit? Armpit measurement is less reliable than oral measurement. To obtain a relatively accurate armpit reading, the thermometer must be held very tightly. The measurement must last at least 5 minutes, preferably 10 minutes. The person must remain completely still. In reality, very few people follow these conditions properly. What about rectal measurement? This is an option when young children do not cooperate, but it must be understood that rectal temperature is only accurate when the rectum is empty, with no stool present. If stool is present, the temperature reading will be inaccurate. Therefore, the order of preference is oral measurement, armpit measurement if oral measurement is not possible, rectal measurement when it is unavoidable. One more very important point is this: do not look only at the number, but look at the entire progression and the accompanying symptoms. There are people with a temperature of 38.5 degrees Celsius who are still alert, can drink fluids, eat a little, and can be monitored at home. There are others with a temperature of only 37.8 degrees, but who are lethargic, have difficulty breathing, or have bluish skin, and that situation is far more dangerous. Now, I want to move on to another topic that many people ask about. Why are there so many different patterns of fever? There is continuous high fever. There is intermittent fever. There is a sinusoidal pattern of fever, where the temperature rises high, then drops below normal, then rises again. There is prolonged fever lasting many days. Each fever pattern suggests a different group of diseases. For example, a continuously high fever that persists and is very difficult to reduce should make us think about lobar pneumonia or severe infection. A sinusoidal fever pattern, where the temperature rises high, then drops below normal, then rises again, should make us think about severe infections such as pyelonephritis or certain special diseases. In some cases, simply analyzing the characteristics of the fever pattern can help orient the diagnosis very accurately and can even save a patient's life. Therefore, when someone has a fever, what matters is not only how many degrees, but also, does the fever rise quickly or slowly? Is the fever continuous or intermittent? Is the fever higher during the day or at night? Is it accompanied by severe chills or shivering? If family members remember these details and report them to the doctor, they are far more valuable than simply saying there is a fever. Now, I want to return to a phenomenon that many families have experienced, but rarely fully understand. Why does fever often become worse at night, especially from midnight to early morning? In healthy people without illness, body temperature is higher during the day and lower at night. But when a person has a fever, the opposite often happens. Nighttime fever is usually higher than daytime fever. This is not random. It is directly related to the biological clock of the immune system. Our bodies do not fight viruses and bacteria in a random way. There is a very clear rhythm. During the day, the immune system works continuously and consumes a great deal of energy. Toward the evening, it begins to tire. The later it gets, the more immune activity declines. About 1 hour before sleep, immune activity reaches the lowest point of the day. At that time, the body's ability to control viruses and bacteria is reduced, and that is when fever is most likely to surge. After we fall asleep, the body begins to switch into recovery mode. The immune system is recharged. From midnight toward early morning, immune activity gradually increases and reaches its peak around 5 to 6 in the morning. This may sound like a good thing, but this phase also carries significant risk. When the immune response becomes too strong, it can trigger a very violent reaction called a cytokine storm. A cytokine storm is a situation in which immune cells release a massive amount of chemical mediators to destroy pathogens. These substances are both weapons and double-edged swords. They help destroy viruses and bacteria, but at the same time, that is why many families feel that the medication doesn't work. In reality, it is not that the medication is ineffective, but that the timing of use is not appropriate. During the plateau stage of fever, or when fever causes disturbances, fever-reducing medication has a clearer role. During the stage when the fever is going down, medication is usually not needed because the temperature is already decreasing rapidly on its own. Paracetamol is the fever-reducing medication that is most commonly recommended because it is relatively safe when used at the correct dose. Other medications, such as aspirin or ibuprofen, require greater caution, especially in children and in the elderly. Personally, in my actual clinical practice and in my consultations, I use fever-reducing medication very sparingly. Most cases of viral fever only require rest, adequate replacement of fluids and electrolytes using oral rehydration solution, close monitoring. In these cases, the fever usually resolves on its own quite quickly. Medication, even good medication, is always a double-edged sword. Use it when it is necessary. Do not overuse it. The most important thing is still understanding fever, so that we do not fear fever excessively, but also do not underestimate it. At this point, I want to slow down a little, not to introduce new knowledge, but to gather everything we have just gone through and place it properly into everyday life. Because fever, snoring, lack of oxygen, fatigue, accidents, illness, all of these things are not found in textbooks, but exist in every household. I see many people come to the hospital in a state of panic, not because the disease is extremely severe, but because they do not understand what is happening to their own body or to their loved ones. Some people panic as soon as they see a fever. Some people ignore snoring. Some people endure fatigue and try to push through it. And then, when something truly serious happens, they are unable to react in time. I say this very honestly. Understanding just a little more sometimes can save an entire lifetime. Fever is not the enemy. Snoring is not just nose. Daytime sleepiness is not laziness. Prolonged fatigue is not simply a matter of old age. The body always has a way of talking to us. The question is whether we are willing to listen. If a person has a fever but remains alert, can drink fluids, can eat a little, and can sleep, then do not panic. But if fever is accompanied by confusion, labored breathing, chest pain, persistent vomiting, seizures, or high fever at night that does not subside, then do not hesitate. The same applies to snoring. If someone snores occasionally when tired, after drinking alcohol, or after staying up late, that is a reminder to adjust lifestyle habits. But if snoring is loud, regular, accompanied by pauses in breathing, daytime sleepiness, poor memory, irritability, or high blood pressure, then it should not be taken lightly. No one likes to hear that they have a disease, but avoiding the truth does not make illness disappear. I always tell my patients, and today I tell you as well, Going to see a doctor is not because you are weak, but because you want to live longer and live well.